Hey, it's Ed. Welcome to another edition of Meet the Authors for the new book, Voices of Innovation, the AI edition. So this is Voice of Innovation, the second edition, but the AI is the first of its kind, coming out at HIMSS in mid-March 2025 in Las Vegas. Super excited. And the book is only made possible by having amazing contributors like my two guests today, Wael Saaouth and Michael Schostak. Well, let me start with you. Tell us a little bit
Thank you for
about
having
yourself,
us.
about your
My name is
background. What do
Wael
you do?
Saaouth. I'm a physician. I'm an anesthesiologist based out of Michigan, and my daytime job includes clinical practice and research and a little bit of AI and medical technology. So I was pretty excited to contribute to the book.
Awesome. And Michael, what about yourself?
Sure. So Mike Schostak, I'm based in Detroit, Michigan, same as Dr. Saaouth. I'm a regional medical director, so I cover practices in southeastern Michigan, including the VA and DMC, as well as North Ohio. I'm about 25% clinical these days, and so I am using AI by necessity to get work done.
That's awesome. And I know that's going to date this video a little bit, so one of us will have fun with it. But Sunday night, who are you going with, Lions or Vikings?
Come on.
There's only one public answer to that.
I know. I'm a diehard Vikings fan, believe it or not. So when I first moved to the United States, I was 10 years old. I came from Europe. I'd never seen American football. My life was soccer. And I turned on the TV and there was this purple team. And I was like, I like purple. And they were actually pretty good back then in the 70s. So I stuck with them all these years. And that's why I have no hair because, they stress me out all the time. But that's going to be a fun game. And I'm so glad actually for both teams. They're both great teams, both great coaches. So it'll be an interesting game. But one of us out of this group will have fun with the other. That's for sure when it roll over. But hopefully, as long as someone from the North Division, goes to the Super Bowl, it's all good. All right. So back to the book. So Mike, let's start with you.
Sure.
Tell us a little bit about the contribution that you all made. Like what's it about? We don't want to give it completely away because we want people to buy the book, but tell us a little bit about the contribution.
Sure. I think what I sort of extrapolate on in the book is that we're putting AI into a couple of categories because it's such a massive term that it's hard to have a intelligent or articulate discussion unless you start putting some constraints and some guidelines on some framing on what you're talking about. So the two biggest buckets, so to speak, one is administrative support. And these are places where it's are incredibly helpful. And it's also a lower risk application because we're not talking about things that touch the patient directly. Although indirectly, if you tell anyone that they can have some percentage more time to deal with patients and less time on administrative work, that is incredibly valuable and probably improves patient care. And then the second bucket is how can we use these tools to improve the care that we deliver, whether it's in a differential diagnosis or whether it's in sort of note summaries, journal lookup, all these types of applications are valuable. And I think one place where I want to redirect people a lot is we don't need a tool to be 1,000% perfect. That's ridiculous. And that's not the measuring stick. We're talking about things that are presently being done by, wonderful medical students, but people that also make mistakes, doctors that are, physicians that are busy and so often make mistakes occasionally. And so we're talking about something that I don't want to say good enough because I think that doesn't do it justice, but it doesn't have to be perfect. And so once you kind of redirect your brain away from that, the fact that you still got to do your diligence and you still have to look through these things and use all the skills that make it important to be a doctor, it makes it easier to use these tools. And so not to dive too deep, but that's, I think, the framework that I put together.
I love that.
I think we've been talking about AI quite extensively recently, and it's not really a new term. It's been around for most of the past decade. But we talk about individual uses of AI, and we talk about how it's going to increase efficiency and make us work better and make us get better results. We don't talk about how we can utilize it to recognize the people who are using it or who are doing a great job on their own, but now are working within an environment of AI. So one of the points that we highlight in this piece is that AI can be utilized to kind of recognize the good players in the team, and it can be utilized to socialize that practice, the good practice that they do, to the rest of the team, and it can provide a healthy level of recognition versus competition versus productivity that doesn't necessarily wear them out as they work.
Yeah, I love it. I love the contribution. I've had the benefit, obviously, of reading all the contributions. It's an amazing book, thanks to great authors like you. And as you know, all the royalties. And so thank you for your labor of love, really sharing your stories with the world, helping other organizations and institutions, leverage AI. And not only is going to help them and their patients and their clinicians and their communities, but all the royalties are going to Mayo Clinic Foundation for cancer research to bring more cures for cancer patients. So thank you so much for being part of the book and for contributing
Absolutely,
and taking the time and effort.